1. Which principle of adult learning emphasizes the need for learners to connect new information to their prior experiences? A. Behaviorism. B. Experiential learning. C. Cognitive dissonance. D. Competency-based education. 2. When designing a CRA training curriculum, which method best ensures continuous improvement of course content? A. Relying solely on learner feedback forms. B. Conducting annual peer reviews and needs assessments. C. Using only standardized national curriculum templates. D. Avoiding changes unless mandated by regulatory bodies. 3. What is the primary purpose of a formative evaluation during a radiology administrator training program? A. To determine the program's overall success after completion. B. To meet external accreditation requirements. C. To provide ongoing feedback to improve learning outcomes. D. To compare the program against industry benchmarks. 4. Which communication approach is most effective when mentoring new radiology leaders through complex policy changes? A. One-way directive communication. B. Informal discussion without documentation. C. Active listening and feedback loops. D. Strict adherence to hierarchical reporting. 5. Which type of assessment would best measure a CRA candidate's ability to apply compliance knowledge to real scenarios? A. Multiple choice written test. B. Role-playing case study. C. Peer evaluation survey. D. True-false knowledge check. 6. When aligning curriculum development with regulatory standards, which factors should be prioritized first? A. Cost of implementation. B. Learner satisfaction. C. Accreditation requirements. D. Technology trends. 7. Which principle of adult learning is violated when a trainer fails to explain the practical relevance of a new policy? A. Readiness to learn. Self-concept. C. Motivation to learn. D. Experiential foundation. 8. Which communication strategy most effectively mitigates resistance to new compliance protocols? A. Issuing compliance memos with minimal explanation. B. Conducting interactive town hall sessions. C. Posting policies on a shared drive only. D. Delivering information strictly via email. 9. Which of the following is the most reliable method to evaluate the long-term effectiveness of a mentoring program? A. Immediate post-session surveys. B. Tracking mentees' retention and career progression. C. Counting attendance in mentoring sessions. D. Asking mentors for anecdotal reports. 10. What is the most critical component when developing measurable learning objectives for CRA training? A. Using vague but motivating language. B. Aligning objectives with organizational outcomes. C. Writing objectives with subjective terms. D. Excluding assessment methods. 11. When mentoring staff on regulatory updates, which approach ensures maximum engagement? A. Provide a copy of the regulations and leave them to review. B. Facilitate a collaborative discussion linking updates to daily operations. C. Present a 1-hour lecture with no Q&A. D. Send a summary email with deadlines. 12. Which evaluation model measures the impact of training on organizational results, such as quality indicators? A. ADDIE model. B. Kirkpatrick's 4 levels. C. Bloom's taxonomy. D. Andragogy model. 13. During a compliance audit, a gap in documentation is discovered. What is the best instructional approach to prevent recurrence? A. Issue a disciplinary warning. B. Provide a refresher course with hands-on documentation exercises. C. Remove staff responsible from the process. D. Reduce audit frequency. 14. Which mentoring style encourages critical thinking by asking probing questions rather than giving direct answers? A. Directive mentoring. B. Facilitative mentoring. C. Authoritative mentoring. D. Prescriptive mentoring. 15. Which adult learning theory supports the use of problem-based case studies in CRA education? A. Humanism. B. Constructivism. C. Behaviorism. D. Nativism. 16. Which tool would best evaluate the transfer of training to workplace behavior? A. End-of-course knowledge test. B. On-the-job observation checklist. C. Learner satisfaction survey. D. Instructor self-evaluation. 17. Which communication barrier most commonly hinders compliance training in a radiology department? A. Overcommunication of policy details. Use of technical jargon without clarification. C. Excessive use of visual aids. D. Providing multiple opportunities for Q&A. 18. What is the primary advantage of using competency-based assessments in CRA preparation programs? A. They are quicker to administer. B. They focus on practical performance over rote knowledge. C. They eliminate the need for instructor evaluation. D. They do not require measurable standards. 19. When creating a curriculum for radiology administrators, which step comes first in the ADDIE model? A. Development. B. Design. C. Implementation. D. Analysis. 20. Which mentoring practice best supports succession planning in radiology administration? A. Assigning mentees to observe without engagement. B. Providing structured leadership development plans. C. Allowing mentees to choose topics informally. Avoiding performance feedback to reduce stress. 21. Which method is most effective for evaluating communication skills in CRA candidates? A. Multiple choice test. B. Oral presentation with rubric-based scoring. C. Written self-reflection. D. Automated online quiz. 22. When designing a compliance training module, which element ensures adult learners retain information? A. Passive video viewing. B. Immediate application exercises. C. Reading long regulatory texts. D. Memorizing acronyms. 23. Which mentoring outcome best demonstrates program success? A. High number of mentor-mentee pairings. B. Documented improvement in mentees' leadership competencies. C. Informal positive feedback. D. Completion of scheduled meetings. 24. Which communication channel is most appropriate for urgent regulatory updates that impact patient safety? A. Monthly newsletter. B. Formal annual training. C. Real-time department huddle. D. Passive e-learning module. 25. Which type of evaluation focuses on determining if a training program should be continued, modified, or discontinued? A. Diagnostic evaluation. B. Summative evaluation. C. Criterion-referenced evaluation. D. Norm-referenced evaluation. 26. In adult learning, which factor most strongly influences motivation to engage in CRA training? A. Opportunity for immediate application. E. Number of assignments. C. Instructor's title. D. Peer competition. 27. Which strategy would best address low participation in mentoring sessions? A. Make attendance mandatory, without explanation. B. Offer incentives and align sessions with career goals. C. Reduce the number of available sessions. D. Eliminate mentor feedback. 28. What is the most appropriate first step when a new regulation requires significant workflow change? A. Train staff after implementation. E. Communicate rationale and expected impact before rollout. C. Issue penalties for non-compliance. D. Wait for staff feedback before planning communication. 29. Which technique helps ensure that learning objectives are aligned with accreditation standards? A. Cross-mapping objectives to accreditor requirements. B. Reviewing objectives once every 5 years. C. Relying solely on internal expert opinion. D. Writing objectives broadly to fit multiple standards. 30. Which assessment format best measures higher-order thinking in CRA candidates? A. True-false test. B. Matching exercise. C. Scenario-based simulation. D. Fill-in-the-blank quiz. 31. Which type of feedback is most effective in adult mentoring relationships? A. General praise without specifics. B. Constructive, timely, and behavior-focused. C. Delayed feedback given annually. D. Group-based criticism. 32. Which factors should be considered when selecting delivery methods for CRA continuing education? A. Learner accessibility and preferred learning style. B. Instructor's personal teaching preference. C. Tradition of delivery format. D. Lowest cost option only. 33. Which step is essential to ensure regulatory compliance training remains current and relevant? A. Updating content only when problems occur. B. Continuous review and revision based on policy updates. C. Keeping content static to avoid confusion. D. Ignoring minor regulation changes.